Hi, this is going to be a brief video just to summarise the standard pre-purchase examination procedure so that you know what to expect if you're having a horse vetted. So we tend to do 5 stages, and stage 1 is an overall clinical examination of the whole horse from head to toe. We're looking for any evidence of old or new injuries, lumps and bumps, surgical scars or any other abnormality that comes to light. And this is also when we listen to the heart and lungs and check the eyes. In order to do a full examination of the eyes, it is necessary to have a darkened room which dilates the pupils so that we can do a full examination of the back of the eye. Stage 2 is a walk and trot of the horse in hand, initially in a straight line, and then if there is a suitable surface and the horse is of a suitable temperament, then may also include a trot in a circle, as well as sharp turns and backing up, and also flexion tests of each limb. So if only a 2-stage vetting is requested, this is where the examination finishes. However, the full 5-stage vetting is advised because there will be some conditions that only become evident during or after exercise. The form of exercise undertaken in stage 3 will depend on the intended use of the horse, but the primary aim is to observe the horse at different gaits, ideally under saddle if possible, on the bridle and working on both reins. The exercise phase should be strenuous enough to make the horse have a good blow so that the vet can assess the wind and the heart under pressure. The horse is then allowed to recover from exercise, and this phase is typically 20 minutes long, and allow the recovery of the heart rate and the breathing to be assessed. During this phase also gives an extra opportunity to observe for evidence of vices such as crib biting and box walking. Then once the horse has cooled off and recovered from exercise, a second trot up is performed because there will occasionally be signs of lameness visible at this stage that have become exacerbated by the exercise and rest phase. A blood sample is routinely taken for storage during a vetting, which can be tested in the event of any dispute following the sale. This protects against suspicions of medication being used to improve the horse's performance during the vetting. Further tests can also be run on request, which might include a general health profile or tests that may be required for breeding or export. Then there may be additional tests that are thought to be necessary. A lot of sport horses or race horses will be subjected to a standardised protocol of scans and x-rays, or these may be targeted according to findings that have come up during the process of the vetting. A full dental examination with a speculum isn't part of the routine vetting, but again can be performed if thought necessary or requested. And an endoscopy examination of the airway is also often included, particularly in the vetting of a sports horse or racehorse, to look for any signs of upper airway obstructions or lower airway inflammation or bleeding. And so finally, all of this information is compiled into an opinion of the suitability of this horse for purchase for the intended use. And this isn't a clear pass or fail, but involve a discussion regarding the likely significance of findings and the degree of risk the purchaser is willing to take, as well as the importance of factors such as future resale value. For instance, a finding of osteoarthritis may be acceptable for an old schoolmaster bought to teach a child to ride, but wouldn't be acceptable for a young horse intended for resale as a high-level show jumper. Each conclusion will be specific to this purchaser and their particular requirements. So hopefully this has helped clarify the stages of a vetting, what's included and the additional options available. And as ever, if you have any further queries, you can visit our website www.bakermcveigh.com.